So to help one man, 15 people will have to be killed. Doctor, if your patient has hypertension, you should not stop the drugs. I was telling our policemen and other friends in the morning, there are two things for every drug which you should know. One is called NNT, number needed to treat. The other one is called ADR, what is the risk of side effects. If you know that, most of you won't take any tablet. Did you know that? Supposing you want a cholesterol lowering drug, let us say statin. The NNT is 300. That means you have to treat 300 people to help one imaginary man. You don't know who he is. So you treat all the 300 people. This is our statistics. NNT, you know NNT, this professor knows. Now what is the percentage of side effect? 5%. So 300 into 5. What happened? 15 people get side effect. Who benefits? One man benefits. That too imaginary. So to help one man, 15 people will have to be killed. Good statistics, isn't it? Blood pressure lowering drugs. NNT is 850 and side effect is 10%. So 75 people will have to be killed to help one man prevent a stroke in the next 5 years. And unfortunately, Glasgow stroke report says 48% of people who get a stroke are controlled blood pressure, normal blood pressure. 42% have no blood pressure, they still get a stroke. Still we say blood pressure is the cause of stroke. And I'm going to prevent it by giving these drugs. But I never tell what happens if you keep on taking this drug. Then we have another very interesting thing which the companies have taught doctors. Not the pharmacology class. They don't listen to pharmacology very well because pharmacology is a very dry subject and they forget about it. Company fellow comes and says, Doctor, if your patient has hypertension, you should not stop the drugs. He must permanently take it even if the blood pressure is normal, because if he stops it, it will go. The doctor is also frightened. He thinks it goes through the roof. So when the patient normal blood pressure also, you go on giving the tablet. Studies have shown that when once your blood pressure is normal, you can slowly taper off and stop the drugs. In case it goes up in about 5% of the patients, it might go up, then you can retake it. What is the problem? No problem. But this is not percolating down to the doctors, because who reads research in medicine after he passes his MBBS, MD or A, B, C, D, E, F? They go by what they read in the textbook, if they remember that. Otherwise, what they learn from the pharmaceutical representative. The postgraduate education for doctors, by and large, is from the pharmaceutical company. No, I'm telling you that. Now we have so much of what's called CME. I go for so many CMEs. They get these ACE speakers. They're all funded by the drug companies. They've got beautiful slides. They talk very well. And those slides are shown. People get impressed. And what are they selling? They are dignified agents of the drug companies, that's all. First class ticket. A car is given for the whole family to tour all of Gujarat. If the conference is in Surat, they can go to Ahmedabad, they can go to Vadodara, they can go anywhere, Kutch, and come back, all at the company's cost. And they stay in Gateway Hotel or some 5-star hotel and enjoy life. But what are they doing? They're selling the company's ideas to the doctors. And at the end of the conference, doctors go home. There's a friend of mine who went for a cruise in Singapore, because while coming I saw the advertisement of cruise. May, there is a cruise. And in Surat it was there because all of you have money, And I was looking at it and suddenly remembered this fellow. This fellow is an ordinary man in Mangalore, so he and his wife went for a cruise after saving money for about 10 years. And there, when she went to the breakfast table, everyone was Indian. See, this cruise started in Singapore and everybody who was in the ship was Indian. So she said, Indian economy has gone up very well. It's not only in Surat, all over India, the GDP has gone up. So one day she started talking to another woman in the breakfast table. They said, no, we are all from a drug company sponsored thing. 750 of us are from the drug company. The drug company has paid for money for us. So you get a cruise. Today, if I write a tablet, it is recorded, it's all computerized now. This is one of the bane of computerization. The minute I write a tablet, M Hegde, a tablet X, computer, it goes to the pharmacy man, he says M Hegde, computer a tablet X. It goes to the company, M Hegde, computer S. If the number becomes 100, the company sends you a representative next time. Sir, you are doing very well with our tablet X. So, company has said you will get some compliment if you do this. You take your wife and go to United States of America and have a once holiday at our cost. So you are writing more tablet. Whether the patient needs it or not is the next question. And you go on. Now, if you are a diabetic, you have your experience. You go to any doctor, he says, pen, not writing pen, insulin pen. Insulin pen, very easy. You don't have to calculate the dose. You simply give. It's very nice. So you fall prey for that. But what is he doing? He is selling their insulin pen, and that insulin which is very expensive, which you don't need. You can make do with nothing, or probably some drugs, or some change of lifestyle. But you are taking insulin. And his count goes up. How many pens he has sold? This is what is hurting me.